Hello everyone. This is about the oldest, honest, reliable man of radiology. I mean, he is the Kattappa in today's radiology, Bahubali. The first case is about the X-rays of a newborn baby focusing the chest and both the forearms. Think about the findings and the probable differential diagnosis. You can see the infant feeding tube tip being at the upper thoracic level with visualization of large gas-filled stomach, which is highly suggestive of esophageal atresia with tracheoesophageal fistula. Also, the X-ray chest reveals mesocardia with bulge on the right side cardiac silhouette and the echo revealed ventricular septal defect. X-ray of right and left upper limbs reveals evidence of bilateral club hands with absence of left radius. That's called left radial aplasia. All these findings are highly suggestive of Bacterial association or syndrome. If you are interested to know everything about Bacterial, I am giving the link above which is discussing in detail about it. Go through that now or later. Let's go to Sivagami style, who is more powerful than our Kattappa. Sivagami can do a lot of things where Kattappa cannot do. I am talking about the ultrasound. You can see the ultrasound pelvic images of a 25-year-old young girl. What are your findings and the probable diagnosis? Caesarean section has been done 2 months back, and for the past few weeks after that, she has been having profuse bleeding on and off, and her anemia is now less than 6 grams per deciliter. And you can see that the ultrasound revealed a small bulge at LSCS scar level, and on Doppler there is a twinkling color which is indicating pseudoaneurysm, and it was confirmed and it was surgically corrected. Now let's go on to Avantika, who is helpful many times. This is Doppler in right side of the neck, again a young lady focusing the internal carotid artery. What's your diagnosis? And it's very easy. There is a round color flow showing yin-yang appearance, also called as to and fro color, which is highly characteristic of pseudoaneurysm due to blunt trauma few months back, and that's causing this pseudoaneurysm formation. Sometimes Kattappa and Sivagami alone may not work, whereas similarly X-ray or ultrasound alone by solo doesn't work, but the combination works very well. Let's see the teamwork of Kattappa and Sivagami. This is about a 12-year-old boy with abdominal distension due to chronic constipation. See the ultrasound and X-ray images. What do you think? On ultrasound, there is significant gaseous, that you can see that gaseous distension of the sigmoid colon, which is displacing the posterior bladder wall anteriorly, which is characteristic of chronic constipation. But the X-ray abdomen revealed huge megacolon of the entire sigmoid colon. You can see that it's going up to the upper abdomen. But after colonoscopy and biopsy, it turned out to be late onset Hirschsprung's disease. Now, we finally will go to the main man of the film Bahubali, and we are going to talk about, in radiology for me, it's the CT. So this is a 75-year-old man having a lot of weakness, abdominal weakness for few weeks with dysuria. Ultrasound was done and it was unremarkable except large right renal cyst with bladder wall thickening. Now I am giving the axial and sagittal reconstructed video of CT abdomen after IV contrast with few images of that. What do you think? The findings are really characteristic. So if you think about the final diagnosis, you are really great. So I'll talk about the findings. You can see that there are multiple blastic metastases in the bony spine and in the bony pelvis, with a large bony destructive soft tissue mass in the left side of lower pelvis. Here the prostate was looking normal even on ultrasound as well as on CT, but the PSA was highly elevated, prostate specific antigen was highly elevated, and biopsy was done and it revealed metastatic CA prostate. Now let's go to Devasena. She looks sweet and soft, but she is very powerful. So I'm talking about MRI. I'm going to talk about the MRI neck of young girl with painless swelling of the left side neck noticed for the past few months. Ultrasound findings were suspicious of tuberculous abscess. So now I'm giving the MRI picture for what's your diagnosis. It looks like tuberculous abscess or any abscess, then it's wrong. It is a typical of branchial cleft cyst. So if you have diagnosed it by seeing these images, pat yourself because it's type 3 branchial cleft anomaly. So now we'll go to the next scenario. Bahubali and Devasena together always help each other I'm giving the T2 weighted axial video of upper abdomen. You can suspect something and I'm giving the CT pictures to finalize the diagnosis. You got the diagnosis? Yes, it's hilar cholangiocarcinoma, also called as Klatskin tumor. Many times Devasena helps Bahubali, it is brain and spine. So that's a well-known fact. But sometimes Bahubali defends Devasena. It's very, very rare usually in our practice. But I'm giving that situation. A 34-year-old man after few days of fever became admitted with facial puffiness and had altered sensorium. So that's why MRI brain was done, and then CT neck was also performed. Because what are all the findings? Can you think about the diagnosis? MRI brain was looking normal, means it was unremarkable. But however, the CT images showed soft tissue swelling of the maxillofacial region with few nodules of varying sizes and densities in the upper lung. Now history taking is very much important here, which revealed that he had undergone to a dentist a month back for non-specific dental pain, and he suggested dental extraction, but he had refused. The patient had refused, and so it had been treated conservatively. He had been having uncontrolled diabetes for many months with HbA1c of more than 11 now. So in this background, we can see periapical abscess in the right side bony tooth with extensive soft tissue swelling, which is indicating Ludwig angina, and you can see the nodules in the lungs are indicating septic emboli. So Bahubali gives the conclusion that dental infection which has progressed to severe cellulitis of Ludwig angina, giving septic emboli nodules in both the lungs. So that's the end of the session of Bahubali in radiology. Thanks a lot and take care, please.